Did you plan your pregnancy? How did your mother reacted on your pregnancy, or when you told them that you're pregnant? Mother was hard. Mother was hard. Anyway, I'm joking. We are talking about my pregnancy experience, and if you have not subscribed to this channel, I don't know what you're waiting for. Make sure you subscribe, like the video, share, comment. If you want to know my experience with the first pregnancy, don't ask me if I have the second pregnancy, but the first pregnancy we are talking about is corona babies are turning 3 years old just in a few weeks. Corona babies are turning 3 years in a few weeks, and I promise that before the second pregnancy, before the news of the second pregnancy, I'm going to give you the experience I had with the first pregnancy, and also the experience of being a teen, looking like a teen mom. I'm not a teen anyway, but the experience. You look small than what someone might think. Uko na mimba na uko 18 ama 16. Are you serious? Hey guys, welcome back to this channel. So, why did you decide to become a mother when you are still in school? Mbona mnataka kupangia watu maisha yao? Anyway, motherhood experience, pregnancy experience, and what else again do you want to know? Nothing, but I'm going to tell you motherhood and pregnancy experience. So I think this video might be too long, and then I might decide to do it in series, part 1, part 2, part 3, until I will be satisfied that I've talked about everything that I want to say. So welcome and welcome back. Make sure you subscribe if you have not subscribed, and don't forget to turn your notification bell, and also like the video, share, comment. Now welcome to my pregnancy experience. And before that, after this video, I'm going to tell you, because you like asking people, why did you decide to become a mother? Why did you decide to get pregnant when you were still in school? Yes, I got pregnant when I was still in school, and it was that time of corona. So if you want to know the reason why I decided to become a mother when I was still in school, stay tuned. Make sure you watch the video up to the end, and you watch the next part of it. So, as I have said, it was that time of corona. We have just been released from school. So najua ile time ya corona students were being released from school, and at that time I was not staying with my parent. Yes, I was not staying with my parent. At the same time, I was not staying with the boyfriend. So I was staying with one of a friend and a kind of a relative. So in that period we parted ways. Yes, we parted ways, and it was not out of pressure. The pregnancy was not out of pressure. It was something that was planned. Yes. So when because it was planned, so I literally knew that I'm pregnant. So when the pregnancy was 8 weeks, because I knew and I was aware of everything that was taking place. So when the pregnancy was 8 weeks, vomiting started, nausea and vomiting. Of course, those are the first pregnancy signs that almost anyone who has gone through pregnancy signs usually experience nausea and vomiting. Of course, it started way long back. Kama ni venye nilikuwa 4 weeks, but it was not much. So when nilifika 8 weeks, it became so much. And that was not the thing or the problem that took me to the hospital. The problem that took me to the hospital, I had threatened abortion. Yes, I had threatened abortion. Have you ever had something like that? If you have not had, go and Google, go and ask your healthcare provider, they will tell you, or somebody who knows about it. Here we are talking about our experience. So I had a threatened abortion. At that time, I did not know that it was a threatened abortion. So in my mind, I was thinking maybe implantation is taking place, and that is why there is bleeding. Because when I was that 8 weeks, after starting experiencing the pregnancy symptoms, so one of the night when I was sleeping, I felt, or there was a gush of blood, a gush of blood, usiku, when I was sleeping. So when I went to check, of course I became worried, and in my mind I was saying that maybe this one is what I usually hear, or what I know usually take place when implantation is taking place. The what the someone can have spotting, yeah, but it is not usually too much. But this one was too much. It was not a spot. It was not a spot of blood. It was a bit more. So I remember I said I thought it was maybe implantation was taking place, and there was that spotting of blood. So I just waited until morning. Of course, nilikuwa nimeweka pad, so I was monitoring what was going on the whole at that time, because ilikuja mara moja. Hiyo time hadi hiyo time juu ilifanyika around saa 3 usiku, so nikalala tu vizuri, hatukukuwa na anything, but nilikuwa na feel some mild cramping. So imefika asubuhi, nothing, there was no blood. Of course I went to change another pad, there was no blood the whole day. The next night the same thing happened. Now I got worried. It was not like spotting. I got worried, there was cramping, and now I called my partner, yes, the owner of the pregnancy. Of course I told him what was happening, and because we were not, of course, staying together, he told me that he's going to come the next day, so that we go to the hospital, we check what was wrong. Yes. So that was the reason why I went to the hospital. When I went to the hospital, remember it was that time of corona, so most hospitals, especially private hospitals, were closed. Some of them were only operating on outpatient, and they couldn't have inpatient, some of them. And also, so when he came, we went to the hospital. Yes, we went to the hospital, and I really wanted to be treated in private hospital, because I had this mentality that private hospitals are always good, you know, that mentality that people usually have. Yeah, that is what I had, and that is what I wanted. So I wanted to be treated in one of the private hospital that I thought was good. I'm not saying it was not good. So when we went to that private hospital, we were told, of course they checked if I was really pregnant, because it was not showing. And remember, it was 8 weeks, so nothing was showing apart from me feeling the nausea and vomiting, and the rush of blood that I went to the hospital, the complaint that I went with to the hospital. So they told me, after, of course, they were only dealing with outpatient. There was no inpatient because of corona. Yes, remember we said our corona babies. So it was that time of corona, so they were only dealing with outpatients. So they told us my case might need admission, and they are not admitting patients right now. They are only dealing with outpatient. So again, we opt to go to another private hospital which was near, which was near that hospital. When I went there, or when we went there, ultrasound was 3,000. Remember, we were not having an active insurance. Yes, we were not having an active insurance, and so we were using cash. So ultrasound was 3,000. Yes, 3,000. And remember, hiyo ni time ya corona, watu hawana kazi, people are struggling. Yes, people are struggling even to put a meal on the table. So we said maybe if we go to a public hospital, it will be more cheaper, because of course public hospitals are always cheaper, and some of them are the best. So when we were told it was 3,000, 3,000, and also before they do that, you have to do what? To go for consultation. And I think it was around 2,000, I don't know, 2,500. We said this one is too much, let us go to a public hospital. So we went to a public hospital which was way cheaper. Yes, nani anapenda kuharibu pesa? Hakuna mtu anapenda kuharibu pesa. Mbona uchukue 5,000 uende upeleke mahali at the same services unaweza pata somewhere hata more better. So we went to a public hospital. Ultrasound was 750 at that time. Yes. When I got there at one of the public hospital, and I want to say I was really served well, treated well. I can't complain, because my gynecologist took me through the pregnancy. It was a nice experience with him. Yes, everything was okay. So it was on Saturday. It was on Saturday. So when we went to that private hospital, I was served, or the first person niliongea na yeye was a clinician, and this clinician was so good, so experienced. Unajua, sometimes ukitibiwa na someone who knows what he or she is doing, you can feel, you can tell. Yes, so this clinical officer, I don't know even the name, but I know it was in a level 5 CI. Yes, level 5 CI. That clinical officer was a good one. So this, I told him the history, or the complaint that took me there, and immediately he requested for an ultrasound. I was done for an ultrasound, and we got that I had an ovarian cyst and dermoid cyst. So this clinician, of course, he is not a gyn. He had to call the gyn and tell him what my complaint. Yeah. And another thing I want to complain about that hospital. Yes, that hospital. Karibu tena nipewe another diagnosis of malnourished pregnancy. Of course, bleeding stop. Hizo mambo na bleeding zilikuwa zimestop. But it was bad. It was bad. It was literally bad. Of course, nilikuwa na watu wa kunisaidia. Mguu zangu haziko fura. I never had edema, lower edema. But vomiting was from day one. That from 8 weeks to around 37 weeks. Yes, to around 37 weeks. Another thing, heartburn was not there. But heartburn ingetoka wapi na sikuli? Uko worried? uko so much worried. What else do you want to know about this pregnancy? Because it was bad. Mimi nilikuwa bedridden from hiyo time venye niliprescribiwa what? It was bad. Yani I don't know how to explain the experience that I got, but it was bad. Another thing, I said I could crave for something and then hiyo kitu naletewa, but naenda kutapika. Lakini baadaye nilikuja nikapenda miwa. Nilikuwa nakula miwa hiyo moja kubwa. Then towards the end of the pregnancy nikakuja nikapenda nitreje sausage. Nilikuwa naletewa sijui 34 ama inakuwa 36 ama 24, hiyo kubwa. Within one day. But those ones were towards the end of pregnancy. Another thing that also I used to glow. I used to glow. I don't know, but I just used to glow. Yeah, I used to glow very much. And what else? I never had any danger signs apart from the first trimester, which was so bad because of that threatened abortion. But also I want to talk about that dermoid cyst and ovarian cyst. So when I was after that gynecologist advised the CEO what I'm supposed to do, I was given several visits to the hospital. Nilikuwa nimepewa so many visits to the hospital because of your dermoid cyst. So they were monitoring the ovarian cyst na dermoid cyst kama imefanya nini, reduce. But venye pregnancy ilikuwa ina continue, ilikuwa ina reduce. Every ultrasound there was measurements were reducing. Every ultrasound the measurements were reducing. So by the time I was going to deliver, I only had a little bit of dermoid cyst. Maybe it is still there or it is not there, I don't know, because after I've given birth, I've never gone to see my gyne. But I'm saying that gynecologist was the best. I don't know the name. I would have shouted the name out, but I don't know the name. I've forgotten, unless nimecheck the records, hizo documents zenye nilikuwa nao ndio naweza pata. That gynecologist in Siaya level 5 referral hospital was the best. Maybe mtu amwambie gynecologist, I don't know alikuwa anaitwa nani, Mr. Who Onyango, I don't know, but he was the best. He's the one who told me, because I can remember also within that pregnancy I went to another private hospital and I showed them the result from the ultrasound. Venye waliona niko na dermoid cyst na whatever, the ovarian cyst, that doctor told me that sutoe tu 120k nikutolee hii kitu, ni kidogo tu hii kitu. Namwambia I have insurance. Ati we don't deal with the insurance hapa. 120 for CS. Hata walikuwa wananiambia ati I'm going to deliver through CS. I'm going to deliver through CS. Anyway, I was not for CS, but ingekuwa gynecologist recommended it, asinge hesitate. But sasa this doctor was like, alikuwa after money, si ati alikuwa ananiambia what alikuwa tu like, we si ulete tu hiyo 120, mimi nikufanyie CS nini. The gynecologist advised me that maybe if this dermoid cyst and the ovarian cyst may continue to grow, alisema it continue to grow throughout this pregnancy, and the pregnancy imekuwa at risk yenye uwezi deliver through vagina, you might need to go for CS so that izitolewe, but hiyo throughout the pregnancy zilikuwa zina reduce. So I don't know the reason why this doctor was recommended that. Anyway, that was my experience. So when I was 36 weeks, because the first time they told me, this gynecologist of mine told me I might deliver through CS. So when I was 36 weeks, I went to confirm. I went to him to confirm if the idea is still there, or if it is possible I will deliver through CS or whatever. You know, CS is a major surgery, and it also puts your life at risk. If you want to give birth to so many children, you can't. If you deliver through CS, yes, you can't give birth to more than 3. Of course you can, but inaweka maisha yako at risk. Yes. So alikuwa ananiambia that apart from that it is major surgery and it has so many risks, and the pregnancy is not at risk of anything, everything is okay, let us just wait to see if maybe when I go to labor there will be another indication. But he's not recommending, because everything was okay at 36 weeks. So at 36 weeks everything was okay, and we now prepared to deliver through the vagina, whether kuzaa ni vagina ama ni through CS, zote ni kuzaa. Usifeel ati like mwingine amezaa through CS. Now I heard someone saying that when you wamezaa through CS that they are weak, that they are I don't know what. Are you serious even? Are you serious? Some of the people when you wanazaa through CS, they had no options. Some of those women even went for labor. They started laboring on the way, emergency CS. Some of them, of course, you know that CS, we have so many reasons for you to be recommended for CS. We have some personal reason. We have the patient's wish, and then we have those emergency CS. We have elective CS. Emergency CS, maybe you have started laboring and now all of a sudden everything has stopped. Everything the only thing that you need to do is to deliver that baby for you to preserve or to save the life of the mother and the baby. Emergency CS. And also we have elective CS. Elective CS is for those people who they have conditions that cannot allow them to give birth normally. Yes, like someone is having cephalopelvic disproportion. Pelvic yake ni kidogo kushinda, pelvic yake haiwezi allow the baby to pass. Nothing else this woman anaweza fanya, si ni CS tu. Ama mnataka aende labor alafu akufe huko. Ama somebody has other conditions so many conditions. I will talk about them in one of the medical videos. But hii idea that mtu akizaa through CS, mtu akizaa through whatever, you start like saying that those who have given birth through CS are not strong. It is wrong. So anyway, I've gone outside the topic. I think I've said everything about how my pregnancy was. It was not good. It was that bad. It was not. These pregnancy symptoms, I don't know, the person who named that thing morning sickness, and that thing made me to be bedridden. So imagine hata kuoga na kubrush. Nyinyi wengine mnapatanga nguvu wapi ya glow, wear a full makeup? Like unapataje nguvu ya wear a full makeup? Now you look nice, you some women surely. Mtaniambia siri juu mimi and that person who called that thing morning sickness, please find a name to give it. Find a name, rename it. Rename it. That thing is not morning sickness. Remember, before I used to know that morning sickness, either unamuka tu asubuhi, you feel some little kind of headache, little kind of nausea, and then after 2 hours, 3 hours, you are okay. Dear, pregnancy, maybe tu wacha niwaambie, pregnancy, to me, what I experienced, pregnancy is not something that you should joke with. That sasa, umeona, my celebrities wamepost a nice baby bump, ukashikwa na baby fever, uende, ushike mimba. Kitakuramba. Ati wengine hata mnaamua tu kushika mimba, you want a man. And then ukiachwa na mtoto, you start becoming a bitter baby mama. Bro, if you're not ready for the baby, if you're not ready for pregnancy drama, just leave it. It is not easy. It is not totally easy. Mimba si kitu ya kuchezea. Mimba si kitu ya kuchezea. Usione mtu amepost tuko picha alafu uanze kuchukua unaenda kushika mimba. Kitakuramba ile mbaya, kitakuramba. Like, if you're not ready, if you have not plans for the baby, if you're not ready physically, financially, emotionally, and if you're both of you and the owner of the pregnancy are not ready, please relax. What is wrong with you? Relax. In fact, you should thank God, but relax. It is not easy. It was not easy for me, and it has never been easy. Those celebrities, they don't post the bad experience. Maybe they only few yenye wamepata bad experience with the pregnancy ndio wana few, but some of them don't talk about kukosa kuoga, kukosa kubrush, kukosa kukula, kutapika the whole day. Kwanza mimi I thought I had hyperemesis gravidarum. Nilikuwa natapika yenye hadi natapika hakuna. Alafu wewe hapo umeona Vera Sidika amepost. Unashikwa, unaona hiyo kitu ni mzuri. Anyway, pregnancy ni mzuri if you're ready for the drama. But if you're not ready, please just relax. You are okay like that. Anyway, I think I've told you everything about what I experienced, how it started, what was there, threatened abortion, nausea, vomiting. But I never had another, how do you call them? The what? The danger signs in pregnancy. I never had them. I thank God for that. It was only the pregnancy symptoms that was giving me headache. Apart from that, threatened abortion and dermoid cyst, what? I don't know. Dermoid cyst and whatever. By the time I was going to deliver, they were not there. By the way. But another thing also that I also want to say, that what was Siaya waliniserve vizuri, walinitreat vizuri. What was Siaya what do you call it? Level 5, say level 5 referral hospital waliniserve vizuri, apart from slapping my face with the bad news that hii mimba inaenda kutoka. Apart from that, anything else was good until the time I was going to deliver. That gynecologist that is in Siaya, I can't remember the name, but that one was the best. I had the best experience with him. Also, nurses from the antenatal clinic, they were good. Also, the clinician that served me the very first day, they were good. To sum everything, my experience with the Siaya Referral Hospital was good. Yes, lakini tunajua hakunanga penye hakunanga negative thing. Yes, that is why I've said only the hiyo kunipatia bad news in a bad way, hiyo tu ndio ilinikasirisha kidogo, but hizo vitu zote zilikuwa mzuri. Mimi hata niliambiwa jenda ya mtoto bila kulipa. Sijui nasikianga watu wengine wanalipa ndio waambiwe jenda ya mtoto, but mimi lakini ilikuwa tu siku ya kwanza hiyo kwenye slap na bad news, but hizo ultrasound zingine zenye nilikuwa naenda nilikuwa napata watu wazuri. Inamaanisha mtu mmoja tu ndiye alikuwa mbaya, but the whole fraternity of Siaya level 5 hospital. Anyway, bye. If you want to share with us or with anybody the experience that you had with your pregnancy, you can comment there so that maybe we call, we talk, or we will find a way of sharing our experience with the pregnancy. So bye till next time. Let's meet in the next video where I will be telling you, either I will talk about motherhood experience and the reason why I decided to become a mother. Yes, either one of them. And maybe I will tell you any other thing you want to know. So if you want to ask question, now ask me as a person in the comment section. Like the video, share, comment, and don't forget to subscribe. Bye till next time.